Dr. Sajid here again. We are confronted with a new disease, the monkeypox. Now, before I begin, I would want you to know that there is no case of monkeypox right now in Pakistan. So please don't panic and don't worry. So we're going to talk about what causes it, what are the symptoms, are there any tests, are there any vaccines, and is there a prevention? So let's begin with the cause. The cause is a virus. It's called the monkeypox, and it is related to the chickenpox virus that we don't see anymore. It is obviously present in monkeys and may also be present in some rodents like rats, etc. Seen mostly in Africa, but these days with travel, we have to be very, very careful. So what happens in this disease is that the person gets fever and then gets severe body aches, and this fever may also cause a person or a child or an adult to be very, very weak. And soon a rash develops, and that is the characteristic part of this disease. The rash starts with little bumps, as we call them, and then these become little nodules, and then pretty soon they are water filled and then pus filled. Now, the characteristic thing about this rash is that this is present in on the face and more on the arms and the legs, and it stays for a whole lot longer than the common disease chickenpox. So this will stay for maybe 2 to 4 weeks. And the other characteristic thing about this rash is that it is present in the same stage at the same time. So for example, if they are fluid filled, they will be fluid filled all over. If they are nodules, there will be nodules all over. And the second thing that distinguishes this monkeypox is that the lymph nodes or the glands which are present in the body, for example in the neck here, in the armpit, in the groin, they may become very enlarged, and these also may be what we call tender, or they may cause discomfort. There is accompanied headache and loss of appetite, and the person just feels very, very uncomfortable. Now, how is it transmitted? It basically from the animal to the human. So it can be by a bite, or it can be from an animal who's sick and you pet it and the skin is broken and the virus can come to the human being. There are possibilities that if one human gets it, it may go from one to the other by, for example, coughing, sneezing, etc., or like I said, the broken skin. Is there a particular treatment? Technically, the smallpox vaccine can be effective, but as you all know, smallpox has been eradicated for a long time, and there are no cases of smallpox, and therefore no vaccine is being given these days. Us, the older generation, have had smallpox, but some of us have had the disease, most of us have had the vaccine. But currently the vaccine is not available, so we're not giving the vaccine. If this becomes a problem, then the health authorities may decide to reintroduce the smallpox vaccine. There are other antiviral treatments that can be given, but they're not very effective. And there is a special immunoglobulin, as we call it, but that also is not as effective as the vaccine in actually preventing it. So this vaccine and the treatment are what is a combination of treatment and prevention. Now, how can you prevent it once a person has it? Like I said, and we're all used to this by now because of the COVID, hand washing, wearing a mask, and if you are a doctor or a nurse or looking after a patient, then you have to wear eye protection, you have to wear a mask, you have to wear gowns, and you have to isolate the patient. So this is a serious disease. It can be fatal if it is present in children or otherwise who are not so well, and it can cause complications. So the scabs, when they form, they're still contagious, and there can be secondary infection, there can be pneumonia, or there can be complication of affecting other parts of the body. So in summary, monkeypox, which is a dreaded disease, is around these days, but not in Pakistan. So please be aware of the symptoms, and please check in with your doctor if you think there are any symptoms which look like it. I hope this was of some help to you, and I will come back again with another child-related issue. Thank you.